Alright, my friend, here we go. Famous before. Tuck your chin down like that for me, please. Excellent. And then turn right or turn left. Hold your head up nice and straight. That's excellent. And the other side, please. Wonderful. Chin up a little bit for me. That's great. Turn towards the back wall. And look all the way up at those ceiling tiles. Okay, big smile. Great, thank you. Alright, make yourself comfortable. You didn't even get it. It's a big smile. You're facing the wall.
No, I know, because I heard that joke before. So that's why.
Alright, I'm facing you towards the camera here. You're calling me out. You're calling me out on the camera. That you heard it before. It's a tough crowd here, man. Holy smokes.
I'm sorry.
Alright, well, welcome.
Thank you.
Now, am I paying you today to video you?
No, absolutely not.
Would you like me to?
I would love to.
All right. So we are here today with Amir for his first MaxHarvest Plus hair transplant procedure. You've never had a hair transplant before, correct?
No.
Okay. Are you currently using any preventative treatments to hold on to the existing hair that you have?
Yes, I'm using Propecia and minoxidil.
Okay. Who put you on Propecia?
You did.
Okay. So you're listening?
Yes, I'm listening.
All right. When did you start?
I started 7 days ago.
7 days ago. Okay, so he came in for a consultation. He's a great patient. He's already listening. He's on the preventative treatment, Propecia, which is the #1 FDA-approved treatment that's currently available today. And he's currently only been doing it 7 days without any issues.
No.
Okay. And he did begin the minoxidil, but we don't have the patient start the minoxidil till after the procedure, so that way there's not a problem with coagulation. So he's just continued that. Okay. So what made you decide to have a hair transplant today?
I decided because I feel less confident. So I feel like it's time. I look older. I'm 33, so I thought to get it done.
So did your hair loss keep you from doing sports or going out with your confidence?
More like social situations, yeah.
Okay. And does anyone in your family have hair loss?
Everyone is my family boss.
Okay.
I'm the lucky one.
So
So
we're gonna fix you. All right. Now, I always ask the patient simply what their goals are with the hair transplant. What are your goals exactly?
What do you mean, what my goals?
What are you trying to accomplish?
Well, I'm trying to have my hair back.
Okay. Simple as that.
Simple as
All right,
that.
keep it simple. Okay, excellent. All right, so when we do the MaxHarvest Plus hair transplant procedure, we're trying to maximize that donor area. Instead of just doing a regular 30-centimeter strip, where if the patient has more length, we try to get it. If there's more elasticity available, we go for it. So it's a little bit more of a challenging recovery due to the extra tissue that's taken out. So you're going to be a good patient, take great care of everything?
Yes, absolutely.
Okay, excellent. Did you have any questions about anything before we get started?
I'm just nervous, so.
All right, well, everybody comes in here nervous.
Yes.
Everybody walks out of my office saying the same thing.
Yeah.
That's it. I mean, you watch the videos. Have you watched any of my videos?
I watch every single one of them.
All right.
That's why I know everything.
All right, perfect. All right, so we're going to draw your hairline out here, my friend. Now, I want you to show me with your finger where you would like that hairline if you were to get to just start drawing the hairline today.
Well, the first time you did, whatever you did, I'm okay with that.
Okay, so just put it back.
Just do your magic.
Just do my thing. All right, so basically what we're going to do today is just kind of follow the same exact plan that we did before. So I'm going to draw everything out for you, and we'll talk, and then we'll kind of go over everything. And you know, just this much for the part. Excellent. Good patient, no going to the gym, no heavy lifting, take it easy, let it heal, and you get a great result. Right?
Absolutely.
Okay. I promise you're going to do everything right, right?
Absolutely.
Okay. So what do you think of South Florida?
I love it. I love it.
Love it. Excellent. And when do you gotta go back to work?
Oh, I own my own business, so I go
Whenever you
I'm
want.
like you. Yeah.
Wow. You know what? I hate to say it, but I just impressed myself again. I love it. Look at, it's on the money, man. That's what we call a perfect shot. Look at that. So watch. What do you think?
Sounds good.
You love it? Make sure, man. This is important. Okay.
Whatever you do, your eyes think.
Well,
You're the tailor.
so what happens is that as we lose our hair, we go back this way, but we also go back this way.
Right.
So I have to make sure that this looks natural from the profile, and that way this blends in naturally. So I always get it as low as I possibly can get it, without it looking unusual from any of the angles as far as profile or something like that.
Right.
So this is about on the edges to where I can get you without it looking unnatural from the side.
Yeah, I want it to look
And
natural.
that's the key, is to make sure it looks natural. Now, I never make the two sides look the same. The reason for that is, Amir, is none of us are symmetric. If we take anybody's body and cut it in half, one side doesn't match the other, and that means I never make the two sides look the same. Okay? So I always have one side higher, one side lower on purpose, so that way it doesn't appear eye-catching to someone who's looking at you. Okay? All right, so let me show you. Yeah, I love when I get them first shot. So after the procedure, no going to the gym, no heavy lifting, rest, rest, rest. Follow your instructions. And have you sleep upright for a few nights without coming into contact with the grafted area. And just be a great patient and take great care of everything. Do you have any questions as I'm trying this out for you?
No, just how long I shouldn't go to the gym or.
No going to the gym for 2 weeks after the procedure. That means just take it easy, let it heal. Once the stitches are out, which will be for you minimum 12 days from today, I'll tell you exactly when we're done. Then you can start slowly going back to the gym after you get your stitches out, which for sure I want you to give me 2 weeks on that. Okay, so stitches, 2 weeks. Scabs and crusts will be gone within about 10 to 14 days. The small ones go away after about a week or so. The bigger ones can take upwards to about 10 to 14 days.
And the first well, I came. You did also like you added like something here. You don't think we should do that?
Your temples.
Yeah.
Did you? Okay. So
I'm just
I will do whatever you want, but let's talk about priorities because we got a lot of things that need to be done. So let me kind of talk about this one, then we'll talk about that. Gotta change my jokes.
I'm sorry about that.
Forget people watching, man.
I know.
Keep me on my toes.
Oh, gotta change the joke.
Man,
People are getting bored watching.
They're getting bored saying jokes. Man, tough. Well, I figured they only watch 1 or 2 videos, and then it'll be fine.
They're obsessed like me.
All right. So what I do here is I create the frontal hairline by making tiny little one hair grafts from the top line to the back line in a staggered appearance, so it goes front, back, front, back, front, back. So it doesn't look straight the whole way across the entire hairline. It's all composed of tiny little one hair grafts. You blend it into the existing hairs over here on the side, so it blends into your hairs on the side. I do the same thing over here on this side. Okay. Then what I do is after I build the hairline with the one hair grafts, I put the 2-3 hair grafts behind that, and then I will use those stronger grafts in between to help create the density. Now, this is my priority number 1 is getting that front situated. That's what's going to change your look. It's going to reframe the face, make everything look different to you as far as your first appearance with yourself and as far as meeting others. So priority 1 is there. Priority 2 would be going for this bullseye. Okay. Everyone looks at this and thinks, oh wow, that's a small little area, just fill this. You can't do that.
It's a big area.
It's because if I just fill this and you lose the existing hair around that area, it creates an island of a hair which looks unnatural. So what we have to do is always blend into the existing hairs the entire way around to make sure nothing is unnatural between my grafted hair and your natural hair, so that doesn't come out unnatural when you lose more of your natural hair. So I create what's called a spiral. The spiral, I know you watch my videos, creates the direction angles of the hairs all the way around the entire crown. That feeds the directions and angles of the hair so it covers it, right?
Right.
So priority 1, this. Priority 2 is this. Okay. You see how big these areas are? Okay. So we're opening up these 2 areas. Those are my 2 priorities. For me, I want to be able to get into this vertex as well, but that's not as important because we have hair there, if you're okay with that. So I like to put it where the patient gets the most out of it, where I call it, most bang for the buck. Put it right where they need it. But in a perfect world, it'd be great to get this. So when you ask about doing the temples too, for me, I would recommend today to get the front, to get this, and do our best to get this before we go into another area. Because otherwise I'll do this, and then get these sides. That's risky because this can open up more, this can open up. Then we're taking a chance of putting you on a treadmill for more surgeries. Okay. So for me, this is a huge area. I can take easy minimum of 10,000 hairs to get this area situated. Okay. So I can't guarantee I'm going to get that. So I'll do the best I can. Okay. So I would focus from here, build evenly, start here, priority 1, priority 2, priority 3. Okay. Does that make sense?
Absolutely. I trust your...
Okay. I want you to look at this up close and make sure that hairline's exactly what you want, because what you're looking at is exactly what you will get. Okay. Like it? Yep. It's going to be good, man. You'll see, it's cool. Fits you perfect. And what I'm going to do now is I'm going to trim the area where I get the donor from. Okay, so you'll be able to...
Are you going to shave this part?
I would love to.
Yeah, so...
Oh, please, thank you. So, Amir listened to my videos and he heard what a great idea it was to shave, and I couldn't be happier. It makes my job so much easier. But more importantly, it's also easier for the patient. The patient's able to take care of it much easier without the hairs in the way. So when they're washing it, it doesn't have the potential of dislodging a graft. It just makes it a much cleaner environment for healing, and it makes it overall a better process.
Also, one of your best candidates, Ryan.
Yep.
I saw you shave his head.
Shaved his head. The Aldo shaved, Ryan shaved. I've shaved mine when I had my procedure. So I always encourage the patients to shave if possible. I would make it mandatory if I could, but a lot of patients insist upon not doing it, but it's always my first choice. Okay? Alright, so what we're going to do here is I'm going to trim this area where I get the donor from, so stay nice and still for me. Don't move. And what I do is I go into the area that has the strongest and best donor hair. The donor looks great, just a little bit of a finer donor type. Just kind of what I have as we were talking about. But overall, it's nice density, good quality overall. So we just get you as far as we can get you from one side, as far as we can get you from the other. And that's the area that will be put on the top of your head. Obviously. Okay. Say goodbye. Just take you back. Okay. Alright. You have no idea what the difference between clean head X and it all. This makes all the difference in the world. The patients are able to wear a hat as soon as the next day, as long as it's brand new or clean. Now we're able to see exactly.
Yeah, I'm gonna leave it like this, so I'm not gonna wear a hat because that's what I would look like in 10 years.
Right? This is where you were heading after me.
Yeah, this is a reminder that it was worth it.
Yeah, you know, expensive walk for a young guy.
Believe it or not, my brother, he was 18 and he's completely bald.
He's 18 and completely bald?
Completely.
No hair around the back of transplant?
Well, he has the back.
He's got a little bit, okay.
Yeah.
So is he going to want to fix this too?
Yeah, maybe. Maybe I talked me into it. He was trying to talk me out of it because he's shaving his head. It's like, why don't you shave your head, you know?
Have you shaved your head before?
Yeah, but
okay.
Look at the way shape of my head.
Yeah.
Not good.
And not everybody has a nice head for transplants.
Right.
So some do, some don't.
Right.
And, you got a good looking head, man. There's nothing wrong with that.
Well, we actually shave it. Start shaving.
Let's just shave it. Forget the transplant.
Right.
That looks good, man. That's not bad. Alright, so let me show you what we're doing here, my friend. Okay, so what I do is I trim the area the entire way around. So I go from the one side all the way around like this, all the way around like this. So I take you from one side to the other side, finger the skin coming out, pinch it together. Just take it out, pinch it together. Everything in this area, hopefully, will be on the top of your head. Now when you look at that, now you see what I'm up against. So that's why I don't want to get too crazy on you. Unless, you know, that's a priority. If that's a priority, then we can shift what we would put in the center there.
No, this is a priority.
Oh, that's how I would guide you as well. Okay? Do you have any questions about that at all?
No questions.
All right. You are easy. All right. So now we are going to give you a little something for a little to help prevent pain. This is a combination. Tylenol and Amir. Enjoy.
I got to one of it.
However you want to do it. This is a good. I already took mine. And I know you have no allergies. Enjoy.
Can you have this?
Yep.
Thank you.
Got it. Enjoy. You're easy, man. Too easy. Making my day too easy.
Well, my wife, she's in the medical field, so and I have done all the research, I think. So I got all the questions answered.
Yes, you have asked me a lot of questions. Right.
Yes.
Come back against the wall. Let me photograph you.
Excellent.
All right. These are the lines. And tuck your chin down. Excellent. Turn right or turn left. Hold your head up nice and straight for me, please. That's great. The other side, please. And turn towards the back wall and look all the way up.
And smile.
You got it. Perfect. All right, my friend. Here we go. We're off to the races. We're going to get you some hair.
Thank you, Dr. Bolton. Thank you.